The children of St. Vincent and the Grenadines and the Eastern Caribbean continues to benefit from the kindness, dedication, love and support of the World Pediatric Project and its drive to heal as much children as possible, saving the world one child at a time. WPP continues to mobilize pediatric specialty teams addressing the full spectrum of advanced medical care for children here in St. Vincent and the Grenadines and throughout the Eastern Caribbean. The St. Vincent Orthopedic team is here again for another mission and so far have seen over 50 patients with approximately 15 slated for surgery. For patients requiring more complex and urgent surgical care, WPP coordinates treatment through a network of United States and international partner hospitals. Here are highlights from the latest orthopedic mission.
It's a daddy-daughter day at the WPP Orthopedic Mission. Good morning, and tell me a little bit about yourself and your daughter.
Good morning. My name is Cohen Innes. My daughter's name is Adia Innes. She's just 3 months old. She was born at Milton K2 Memorial Hospital. She was born with myelomeningeal seal. She had some surgeries done. She got infected after the surgery. We had to travel to New York. She did some more surgeries up there, and now we're back with WPP to finish or continue with the checkups.
Okay. The name, how can you break that down? What exactly would you say is wrong with her? Because some persons would not be familiar with the technical term that you referred to.
Well, she was born with the spine wasn't closed properly, so they had to do a surgery to close the spine, and she had a club foot, so they're now trying to straighten the club foot, and they were concerned about the hip displacement, so they're actually checking that now and ensure that the hip is good enough and strong enough to hold her body weight.
The doctors inside just now said that she's extremely strong and stuff. How has that journey been for you?
It was a tough journey. 3 months sitting in a hospital, it wasn't a nice thing at all, but she's a fighter, she's fighting, and she has gained so much strength. She gave us strength, and we gain strength from her to continue our journey.
Okay. And what would you say about your interaction with WPP?
Well, they're being very helpful to us. They came, they did the surgery free of cost, and we see the outcome of that. It was very helpful. We went to New York where we had to pay for our work, and it's just so different getting everything done right here in St. Vincent for free from WPP comparing to being in New York where we have to pay for everything. So it's really helpful now to us.
Anything you'd like to say to WPP?
Well, we would like to thank them for their good work, welcome them to St. Vincent at any time, and I would be looking forward to seeing if I can get any help for them once they're in St. Vincent.
So you're here with Anne, and she's a part of our WPP team, and she's going to tell us a little bit about her experience with WPP and about this trip accompanying the team for this mission.
Yeah, so I've been with World Pediatric Project for going on 3 years, and I have had just an amazing experience working so directly with our mission and the kids that we get to help has been just like life-changing for me in a lot of ways. I connect with volunteers at our office back in St. Louis, and this is my first time on an orthopedic mission. So it's been great to see some familiar faces that I knew back home. Dr. Gordon and his whole team have been so amazing. And I'm just really happy to be here, and everyone's been really welcoming.
Okay. I see you're like a butterfly, bouncing around with the families and having fun with the kids and taking time to just interact with them. What has that experience been like so far for you?
It's been great. It's so nice to feel like, we're coming down here and people are taking a week off of their time at work and away from their families, and then we come and everyone is just like so friendly with us and nice and just want to joke around and say thank you and get to know you, and so that has just been like made it so much better, I think. I think everyone on the team would agree with me about that, so I'm excited to like get to know the rest of the families over this week.
Okay. And how has the team been responding in terms of this specific orthopedic mission?
The team that I work with,
Yeah.
They've been great. So this is kind of a second team that was added on from a trip that goes in April. And so we have about 60-ish families that we are expecting today, and everything's been running really smoothly. A couple members of the team are new and have never been here before, but we're kind of working together, and I think they've been just really happy with it so far. So I'm excited. We'll see how the rest of the week goes.
Okay. If there's one thing you could tell the world about WPP, what would it be?
We are doing something that no other organization is doing, and I want the world to know that, and we love every minute of it.
All right. Thank you. So we're with Rob Moore, and he's our anesthesiologist on the team. Tell me a little bit about the work that you're doing on this mission and how has it been so far?
Oh, sure. Well, it's always a pleasure to come down. It's been pretty splendid. Whenever we meet folks clinically, we're sort of charged with, a surgical encounter is very stressful. So it's sort of a three-phased approach. You kind of meet folks perioperatively and make sure they're ready for surgery, kind of as strong and healthy as they can be. Keep them very safe during surgery, and afterward help them transition back to being normal. So, in essence, getting folks as good as they can be, keeping them real safe, and then getting them back to functioning like little folks should.
And how is the team? How is the team going?
Oh, the team's great. It's a good group of folks. I think everybody kind of, in addition to kind of the clinical expertise everybody brings, we're all driven by the same mission and goal. So it's just a lovely thing to do. Good place to be.
Okay. And what's your personal feeling on working with WPP?
Oh, it's a great organization. If you think about it, when you think about international outreach, there's sort of three goals in the process. First and foremost, you want to take the best care of kids possible. And you want to do it in a manner that doesn't compromise sort of the standards of care you'd expect domestically. And this has been a big push within the medical literature and everything else. And if you look at the way WPP's been doing things over the years, it's way ahead of the curve in terms of that aspect. So sort of bringing the best care possible to folks under the best circumstances in a safe and situationally appropriate manner. So it's everything you'd want in a partner.
So we're here with Dr. Smith, and it's an orthopedic mission, and this is his first time on the mission. So tell me, how has that been so far?
It's been amazing. Yeah, lots of patients. It's been fun to try to help as much as we can while we're here and see how it goes.
What's the best part of your day?
Best part of my day is probably seeing the kids smile when they come in and you're happy to see you and you can help them out. So,
The best part of working with WPP?
The organization's been awesome. Yeah, just everything's been set up wonderfully for us. Just kind of show up and get to work, and everything else is taken care of. So,
Best part of working with the team?
no, it's just fun to interact with all the different people, the nurses, the staff, and the other doctors. So it's been great.
So we're here with a family who will be receiving some assistance from WPP. Can you tell me your name, your daughter's name, and what help you'll be getting?
My name is Katya Hendrickson, and my daughter's name is Jolene Prescott. So she will be doing a surgery on her right knee. So I am so grateful that she will do this surgery, and I would like to thank them very much. And she come through safely with this surgery.
How do you feel about working with WPP, them being able to help you?
I feel good.
You feel good?
Thank you, WPP.
So we're here with Lauren McIntosh, and she's going to tell me her position and a little bit about this orthopedic mission.
I'm Lauren McIntosh, Executive Director of the Eastern Caribbean for the World Pediatric Project. So today we have our general orthopedic mission on island, and it is spearheaded by Dr. Eric Gordon, and he's from St. Louis. He's supported by another orthopedic surgeon as well as the anesthesiologist, and the entire team is it's 8 persons in total, and we're hoping to see 50 persons at the clinic today. And thus far, we have about 13 surgical candidates slated for this week.
And on this mission, is it also a mix of persons from outside of St. Vincent and the Grenadines?
Yes, we do have regional children coming in. We have from Dominica, we have from St. Lucia, and we have from Grenada.
Some persons on this mission is the first time here. How has that been for them so far?
They've all said that, they're enjoying it in terms of the team. They really are. I mean, WPP, the persons who volunteer, they're always very, very keen and very interested in the organization and putting forward our work. And then we also have new children that we're seeing for the first time as well. And the families are usually very receptive. Sometimes they have to come back, so they have to be patient, but they're all good. So you can contact us. We have our office. Our local representative is Sister Jacqueline Brown King. You can contact myself. We have a Facebook presence We also have a website, and you can contact us at any point in time. This mission is actually partly sponsored by Mustique Charitable Foundation as well as Miracle Flights. So I just wanted to extend, thanks to those two organizations for helping us with this particular mission.
So I'm sitting on the bed with Dr. Gordon, but I'm actually not being examined. He's talking to us a little bit about this mission and how it has been for him so far.
So far, the trip has been great. We've seen, I think, 50 patients, so we've still got a few more to go. We've signed up, it sounds like about 15 patients for surgery, and have pretty much filled our OR schedule for the next week or so. I think it's going to be a very productive mission, and I think it's going to be a chance to really help a lot of kids here.
Okay. What's the greatest part of your job?
I enjoy all of my job. I enjoy the surgery. I enjoy being able to help the kids. But I would have to say some of the best times that I have are when we have patients that we operated on a couple of years ago who come back again and are doing well and are back to their activities and just come by to say hello and say thanks. It's just great to see them.
And what is the good part or the great part about working directly with WPP?
The great thing about WPP is that they tend to focus on what we can do and not focus on the barriers. We see kids that are in very difficult situations, and they really work hard at trying to get help for those kids and to try to make their lives better. And that's so encouraging and so great to work with an organization that will do that.